Is sigmoid colectomy surgery for diverticulitis serious? When considering the question of whether sigmoid colectomy surgery for diverticulitis is serious, it is essential to understand the nature of the procedure. Sigmoid colectomy is indeed a major surgical operation. It involves the removal of the diseased part of the sigmoid colon, which is a section of the large intestine often affected by diverticulitis. This surgery is not to be taken lightly, as it comes with significant risks and potential complications. One of the primary concerns is the risk of infection. The bowel contains bacteria, which can lead to wound infections or intra-abdominal abscesses. Another serious complication can occur at the anastomosis, the new surgical joint in the bowel. If this area leaks, it may require further surgery and possibly the creation of a stoma, which is an opening on the abdomen for waste. In addition to infections, other potential complications include blood clots, internal bleeding, and sepsis, which is a widespread infection. There is also a risk of injury to nearby organs, respiratory failure, and even heart or kidney failure. Bowel blockage from scar tissue and incontinence are additional concerns that can arise after surgery. Mortality rates associated with sigmoid colectomy can vary. For elective surgeries, the mortality rate is relatively low, around 0.5%. However, if the surgery is performed as an emergency procedure due to severe diverticulitis, the mortality rate can rise significantly, reaching up to 10%. Recovery from this surgery typically requires a hospital stay of about 2 to 7 days. After discharge, patients are usually advised to limit physical activity for at least 2 weeks. Their diet will gradually progress from clear liquids to solid foods as their colon heals. If a stoma is created, patients will receive specialized care instructions to help them adjust. Quality of life is another important consideration. For patients who experience recurrent or complicated diverticulitis, elective surgery can lead to significant improvements in their quality of life. However, it is crucial to note that this surgery carries a higher risk of post-operative complications compared to conservative treatment options. Patients who have frequent episodes or a lowered quality of life may find that surgery is the best option for them. On the flip side, not having surgery also carries risks. Individuals may continue to experience recurrent diverticulitis flare-ups, which can lead to abscess formation or perforation. These complications may necessitate emergency surgery, which typically comes with higher risks than planned procedures. In summary, sigmoid colectomy for diverticulitis is indeed a serious surgical procedure. It involves inherent risks and potential complications that should not be overlooked. The decision to proceed with surgery should be individualized, taking into account the severity and frequency of diverticulitis episodes, the patient's overall health, and the risks associated with surgery versus conservative management. It is vital for patients to engage in thorough discussions with their healthcare providers to fully understand the risks and benefits involved.